Greetings from Suraj Eye Institute. Retinal nerve fiber layer splaying. Glaucoma results in the death of retinal ganglion cells and the degeneration of their axons. The loss of RGC axon in turn leads to a thinning of the retinal nerve fiber layer. Retinal arteries coming from and veins going to the optic disc travel in the RNFL and contribute to its thickness. Arrangement of the blood vessels influence the RNFL thickness measured with OCT. The double hump pattern was identified in the RNFL profile where the humps fall on or just adjacent to major temporal blood vessels. So the location of the major temporal blood vessels is a good predictor of the variation in the RNFL thickness profile. There are two factors contributing to the correspondence. First, the blood vessels make a direct contribution to the OCT RNFL thickness. Second, the arcuate fiber bundles providing the major contribution to the hump tend to travel with the major temporal blood vessels. A male, 17 years of age, reported to us with chief complaints of diminution of vision in the right eye since 2 years. He had a best corrected visual acuity of counting finger 1 meter in the right eye and 6.6 in the left eye. Slit lamp biomicroscopy was within normal limits and intraocular pressure of 18 mm mercury in both eyes. Fundus examination showed a combined hematoma of the retinal pigment epithelium in the right eye. Left eye with a 0.3:1 vertical cup disc ratio with clinically no RNFL defects and widening of the angulation of the blood vessels was seen. OCT of the left eye showed moderate RNFL thinning in the temporal and the inferotemporal quadrants. Severe RNFL thinning in the superotemporal quadrant with increase of the RNFL thickness in the superonasal and infranasal quadrant suggesting of RNFL splaying. RNFL splaying due to widening of the angulation between the superotemporal and inferotemporal vessels explains the thinning of the RNFL temporally in the left eye. The location of the blood vessels may help predict the variations in the profiles of OCT RNFL thickness. Here, in our case, arrangement of the blood vessels may explain decrease in the temporal RNFL thickness and increase in the superonasal and inferonasal thickness due to the RNFL splaying in the left eye. Splaying may occur due to widening of the angle between the major vascular arcades, which in turn drag the RNFL along, leading to the thinning in the macular area and thickening in the vertical quadrants. This can induce error in assessment as it may show thinning in the temporal quadrants, leading to incorrect diagnosis of glaucomatous or neurological RNFL loss. Location of the major temporal blood vessels can help us to understand RNFL variation. A better understanding of the relationship between the distribution and angulation of the major blood vessels and the OCT RNFL thickness might lead to an improvement in the specificity of the OCT RNFL test. Thank you.